Autism in babies. The diagnosis of autism is not often made in babies. This is mainly because the signals are not very clear at a young age. Yet it is very useful if autism is discovered early. That is why more and more attention is being paid nowadays to early signals that may indicate autism. What is autism? The term autism is popularly used, but nowadays experts refer to the forms associated with autism as ASD, which stands for Autism Spectrum Disorder. It is a developmental disorder that manifests itself differently in every child. One person has a very mild form, and for the other, it is extremely restrictive. In autism, information processing in the brain is disrupted. Children and adults with this disorder therefore have difficulty with social interactions, verbal and nonverbal communication, and imagination. For example, they find it difficult to interpret eye contact, facial expressions, and gestures. Being able to empathize with others is also very difficult. In addition, specific interests and repetitive movements are often involved. For example, babies with autism mainly play with one toy or do the same thing over and over again. Examples of repetitive movements are the flapping of the hands during emotions or the characteristic rocking back and forth, which you probably know from films. Usually, all this leads to problems in everyday life. Cause of autism. The precise cause of autism is not yet clear. We do know that it is genetically determined. The hereditary predisposition causes something to go wrong in the development of the brain, which limits the development of social and communication skills. Diagnosis of autism in babies. Only after an extensive examination will it be determined whether autism exists. This is extra difficult with young children, and therefore with babies in particular. This is because every child develops at his own pace. In exceptional cases, the diagnosis is already made in the first year of life. However, it is now common for this to only be discovered later. My baby is different. Parents of autistic children are often the first to suspect that their baby or toddler has abnormal development. They feel that their child is different. This could be because their child laughs little, because they do not get good eye contact with him, or because he does not seek comfort when he is sad. It also regularly happens that a teacher sees that a child behaves deviantly towards other children. Why is it good to know if your baby has autism? Children with autism experience the world in a different way. The sooner autism is recognized, the better it will ultimately be for the child. In this way, both children and parents can be guided properly. This guidance can ensure that certain symptoms and consequences of autism are reduced. This way, you can make life with this disability a lot easier and more predictable for your child. Early signs of autism in a baby. By paying more conscious attention to early characteristics of autism, we can hopefully ensure that we recognize autism better and earlier. Parents and teachers will then have to rely less on their feelings in the future. Early signals can be recognized from the age of about 1 year. The following clues could indicate that your baby has autism. At 12 months, your baby is not yet pointing or waving. At 9 months, your child is not babbling. Asterisk, at 12 months, he does not smile at others. Asterisk, your baby is not interested in other people at 12 months. He does not respond to being addressed by his name at 12 months. At 16 months, he is not yet using single words. After 2 years, the child does not yet produce short 2-word sentences. Your baby is not showing symbolic play or pretend play at 18 months. Your child has a relapse. He suddenly no longer uses previously acquired skills or language. The signs may indicate autism, but are insufficient for a diagnosis. There may also be another cause, such as poor hearing, poor vision, or an unsafe attachment. An extensive examination is required to diagnose autism. Does my baby have autism? Are you concerned about your baby's development and wondering if he might have autism? Don't ignore your doubts and discuss it with your doctor. If necessary, they can refer you to a specialist. If you enjoyed this video, don't forget to like and subscribe to our channel for more amazing videos like this. Thanks for watching.